Hello, my name is Dr. Alyssa Swick with the Indiana Complex Care Coordination Collaborative at Indiana University School of Medicine. I am here to offer ways to accommodate a breast exam for individuals who need special assistance. Individuals with intellectual or developmental disability, also called IDD, may experience anxiety at the doctor related to unfamiliarity with the situation or a past experience of difficult medical encounters. Lack of cooperation may be related to anxiety and can create challenges in examining some patients. Many individuals are taught that the breasts are a private part of the body, which can create an additional challenge in cooperation. Persons with IDD may have experienced sexual trauma in their past. So the first step is to consider how to best adapt your communication to fit the person. Ask about abilities in both receptive and expressive language skills. Acknowledge accompanying persons and verify their roles. Remember that the person may not be a trusted helper who the patient wants with them in the room for a private history or exam. Key points in communication are: speak directly to the individual. Specifically seek consent or assent when performing an exam or procedure. Explain and demonstrate. Information is easier to understand when large ideas are broken into small parts. Visual tools can be helpful to aid in understanding. Speak and move slowly. Processing time is also slower for individuals with IDD. You may need to allow 15 to 20 seconds after asking a question to get a response. Use simple and comforting language. Use repetition and recap key points at the end of the conversation. Praise cooperation. Take 5 to 10-second breaks when needed. Begin with an explanation of the planned exam. Seek consent or assent. If there is hesitancy, encourage the help of a trusted accompanying person. You may want to have a conversation about the differences between good touch, bad touch, and necessary touch. Good touch makes you feel happy, safe, or comfortable. Bad touch makes you feel forced, hurt, or afraid. Necessary touch can describe touch that might not feel comfortable, but you still decide to do for good health. You may want to help the person seek the input of the person they have with them. You should leave room for refusal. Restraint, coercion, or forcing parts of the exam should be avoided. Demonstrate to help your explanation on a model, a doll, or stuffed animal, or using a picture. Ask about options to distract or incentivize the person to ease the exam. For example, ask what the person wants to do after the exam. First, then language may be helpful. For example, first, we will do your exam, then you can go to McDonald's like you planned. Allow the person to ask for a break. If you recognize that the person is having difficulty, allow for brief 5 to 10-second breaks within an exam to help the person take a deep breath and relax. Consider whether your patient can change into a gown or get on the exam table without assistance. Indicate proper exam gown placement. If there is not a support person who the patient wants to be present, offer a chaperone to help with examining a private part of the body. Direct your patient to remove her arms from the gown and place her hands on her hips, and then her head for visual inspection. Assist her if needed. Maintain comfortable conversation and explain in simple language what you are seeing. Explain how you feel for lumps before checking for supra and subclavicular lymphadenopathy. Move slowly. Allow her to replace her gown once you are done, assisting if needed. Explain that the next part will feel all the parts of her breasts. Assist as needed in reclining on the exam table. Direct or assist in removing one arm from the gown and positioning it above her head. Examine the breast and axilla while maintaining comfortable conversation and explaining in simple language what you're feeling. Reassure if she feels ticklish or uncomfortable during the exam. Offer a break and assist in deep breathing or other calming techniques if needed. Help her replace her gown on the first arm, then proceed with the second breast. If you meet resistance, pause and re-explain. Work with support persons as appropriate, and then make a plan for what to do next. Consider showing the next step on a model, a doll or stuffed animal, or using a picture. Then ask if you can try again. If the individual allows an attempt, praise their cooperation and offer an incentive as previously agreed. Reinforce the concept that the breasts are a private area of the body and that they should not allow everyone to touch them there. Review why you decided together to do the exam today. Review that other touch of the breasts, with or without clothes, are not okay unless the individual is in a private setting and have agreed to the touch. Some individuals may not be able to use the exam table. Consider if you can help them find a supported position by leaning back in a chair. Ask if they want to hold someone's hand during the exam. It is generally recommended that clinicians should avoid forcing any parts of an exam. If there is an emergency reason for the exam, sedation may become necessary. When you have finished your exam, praise your patient for cooperating and offer an incentive if appropriate. Allow the person to get back into their gown or clothes. Discuss your findings and recommendations with the individual. Include the support person as the patient agrees. Use simple language and provide time for them to ask any additional questions. Thank you for watching. To assist your patients in preparing for a breast exam, you can refer them to the partner video at forourhealth.org.